Today, we're talking about Cyproheptadine Hcl. It's an antihistamine that helps relieve allergy symptoms like watery eyes, runny nose, itching eyes/nose, sneezing, hives, and itching. It works by blocking histamine, a natural substance that your body produces during an allergic reaction. Cyproheptadine Hcl also blocks another natural substance in your body called serotonin. It's important to note that this medication should not be used in newborn or premature infants. As for the daily dosage and timing, it's best to follow your doctor's instructions for the correct amount and when to take it. When taking Cyproheptadine Hcl, it is important to follow your doctor's directions. This medication can be taken with or without food, usually 2 to 3 times a day. If you are using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon. Do not use a household spoon as it may not provide the correct dose. The dosage of Cyproheptadine Hcl is determined based on factors such as your age, medical condition, and how you respond to treatment. For children, the dosage may also be based on their weight and body size. It's important not to increase your dose or take this medication more often than directed by your doctor. If you find that your condition does not improve or if it worsens, be sure to communicate this with your doctor. If you experience drowsiness, dizziness, or blurred vision while taking Cyproheptadine Hcl, it is important to let your doctor know. Other common side effects may include constipation, dry mouth, nose, or throat. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any mental or mood changes, shaking, difficulty urinating, fast or irregular heartbeat, or seizures. In rare cases, a serious allergic reaction may occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. Before taking cyproheptadine, make sure to let your doctor or pharmacist know if you are allergic to it or have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using cyproheptadine, it's important to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, high pressure in the eye, heart disease, high blood pressure, kidney disease, seizures, stomach/intestine problems, overactive thyroid, or difficulty urinating. Cyproheptadine may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana, as they can make these side effects worse. It's also important to not drive, use machinery, or do anything that requires alertness or clear vision until you can do it safely. It's best to avoid alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are using liquid cyproheptadine, be aware that it may contain alcohol and/or sugar. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances in your diet, it's important to ask your doctor or pharmacist about using this product safely. Children may be more sensitive to the side effects of this drug, and it can often cause excitement in young children instead of drowsiness. Older adults may also be more sensitive to the side effects of this drug, especially experiencing drowsiness, dizziness, constipation, confusion, or trouble urinating. These side effects can increase the risk of falling. During pregnancy, cyproheptadine should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that could affect how Cyproheptadine Hcl works or increase the risk of serious side effects. Make sure to inform your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. It's important not to start, stop, or change the dosage of any medication without your doctor's approval. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines, it's important to let your doctor or pharmacist know. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's also important to ask your pharmacist about using these products safely. Avoid using any other antihistamines applied to the skin, as this may increase the risk of side effects. It's also important to be aware that Cyproheptadine Hcl may interfere with certain lab tests, potentially causing false test results. Make sure that both the lab personnel and all your doctors are aware that you are using this medication. If you or someone else has taken too much Cyproheptadine Hcl and experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Symptoms of an overdose may include severe drowsiness, seizures, and dilated pupils. In children, you may notice changes in their mental state or mood before they become drowsy, such as restlessness, irritability, or hallucinations. It is important to remember not to share Cyproheptadine Hcl with others. This medication is prescribed for specific reasons and should only be used by the person it was prescribed for. Sharing can cause harm or adverse effects to others. Always consult with a healthcare professional before taking any medication. If you forget to take a dose of Cyproheptadine Hcl, take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Do not take double the dose to make up for the missed one. When it comes to storing Cyproheptadine Hcl, it's important to keep it at room temperature and away from light and moisture. If you have the liquid form, make sure not to freeze it. And remember, it's best to keep all medications out of reach of children and pets. When it comes to getting rid of any expired or unused Cyproheptadine Hcl, it's important to do so properly. Don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.